So the theme of this presentation is really to set some of the scene for some of your discussions. And I think if we talk about information and technology as a key enabler of change, but I think everyone needs to focus on why we're doing it, to help improve people's lives, to support better outcomes, etc. And so I think I'd like everyone to be mindful of that as we, and I'm sure you will be as you go through the rest of the day and the work from beyond this point. And so in doing that, I think we need to begin to explicitly link the elements, our efforts and actions, rather in a kind of lean kind of context, to how they're going to deliver improvements in outcomes for health and well-being. And that might mean people live longer and healthier lives, although they are doing already, and they're fully active and independent, and they're enjoying the best quality of life possible. They're involved in decisions, which is a key challenge for all of us in how information flows across the system, and that it's a community, a locality-based approach. And so we might see that, where are we already? Well, actually, there's probably a lot of information already existing that we don't utilize or leverage, and it comes from multiple sources. The metaphor of water, I think, is useful because of the endeavor, not just Victorian times, but in more modern times. I think this is the Hoover Dam, but the all of the processes that go through creating and harnessing water resources, the planning, etc., the engineering, etc., is quite akin to how we manage knowledge. And the opportunity is vast. We don't necessarily need lots more information. What we might need to begin with is to channel what we have, because we need to convert what we have into benefits. And if you think of access to water as being the end goal here for us, people can turn the tap on when they need it, rather than it being constantly flowing. And I think that's something that I'd like to also, in the work going forward, bear in mind. You can take this metaphor endlessly on, but I won't because of time. So in terms of the DH, what we've done is we've formulated a plan that's pragmatic in the context that we need to focus in two real clear areas. One is delivery of our core program, what we're paid to do and what we might be fired for not doing. And some of the things that we have to focus on are around the Care Act implementation, which you'll all be hopefully familiar with and working on. But as part of that, we're also looking at key projects and programs around the integration pioneers, which is being led by Dylan Roberts from Leeds, and there are 14 of them. I'm not sure if anyone here is one of the pioneers in the Northeast. Does anyone represent any of the pioneers? No. Well, that's important that any sharing and outcomes for that come across to this region. Information governance being a key barrier and to overcome when one looks at information sharing, etc. And moving to tier on, then, what are we doing practically to enable that? We're developing standards. We have funding through the Integrated Digital Care Record Tech Fund, and there have been 20-odd applications for that fund from local authorities, and we hope there are going to be a lot more coming through. And the work that HSCIC are doing with the department and others on setting up infrastructure systems such as secure email, etc. And the second area is, I'd say it's less of a priority in terms of what we have to do now, but we are investing in it, and this program is one of the initiatives to do that. We want to achieve our broader strategic objectives, and to do that we need to think about how we develop an economic case for investment in informatics, whether we know enough about our current state in order to measure progress towards a target future state, and how we do that in terms of developing capability and leadership across service domains and commissioning domains. Okay. So the theme of this particular meeting, and it's pretty broad, is how we begin to develop a target state for social care informatics in order to deliver a more holistic health and well-being enterprise. Where are we headed? The main themes are looking at, you hear about these are things that come out through nationally, how we move towards greater transparency, how we move towards greater self-care, transactional services, and into a state where we are interoperable across service domains and organisations. That's easier said than done. I'm sure you've got experiences, not just with, for example, organisations that are not within your control, but within your own organisation, how departments interact and cooperate, etc. So there are numerous challenges that we know we're going to face in terms of informatics, specifically IT, how we manage identities across services, etc. What are the information standards and protocols that we deploy, how we use common terminologies and definitions. I know that in social care, compared to, say, health, who have got several classification standards, such as READ, OPCS4, ICD-10, etc. No such standards exist in social care, let alone common terminologies and definitions for services across the country. People keep telling us about open architecture and APIs. Do we really grasp what that means going forward and what it takes to achieve that? Having a real customer focus, infrastructure, etc., and the benefits case. These are challenges, but actually we need to do this within local authorities, within the locality, and across service domains. Now, that didn't come out very well, hasn't transferred across the system. So that circle, that red circle goes across the whole of it. I would suggest that actually IT, etc., is not our biggest challenge. It's cultural and organisational. And actually that's the area where we need to start first, because a lot can happen if one's talking to the right people with a common aim, etc. So drilling down a bit more, what really recently is to look at working with the department as the sponsor, working with the Health and Social Care Information Centre as the main provider organisation. We've begun a scoping project. Again, it doesn't like ellipsis. We're looking at identifying the strategic enablers to support the process of integration and improving outcomes for citizens. And they basically form around information standards, client level data, and what we need to do now to start the ball rolling more effectively. So there are 3 domains of activity, and these are work packages that have actually started a few weeks ago. So in around continuity of care, continuing care, what data standards do we need now and downstream, guidance to support that as it's in the Act. What data collections do we have now, particularly those collections that feed the ASCOF, the outcomes frameworks. In fact, none of them are standards, okay? And we need to quickly make them standards through the Information Standards Board. I'll give you an interesting statistics. There are at least 180 collection standards in health, and there are 0 in social care, although there are 8, I think, collections that feed the ASCOF data sets. So it's my job at the moment to put that right. So first step is to get the existing data collections formally adopted as standards, and the Care and Social Care Act says that it has to go through the Information Standards Board to be an adopted national standard. So that's one area of work. Through the work that pioneers are doing, and particularly the work in the information sharing project, which is centres around North London, We're looking at the work there to inform how we put standards around admissions and discharge from acute into social care, which represent the greatest proportion of referrals into social care, and then GP to social care as well. So that's the first urgent piece of work that we're doing, and work packages have started, and hopefully you'll be starting seeing some activity and notices around progress on that. Supporting that, we have work that has been ongoing for some time that the department's involved in, which is working with NHS England, HSCIC and others to produce a secure email across NHS Mail and the government domains. And there are announcements for that. Hopefully procurement is now well underway, and announcements will be made in December as to who the preferred suppliers are. So local authorities are going to be able to enable secure email across service domains from January. Identity management, of course, the NHS number is currently being developed and has been implemented in some areas and not others. The infrastructure challenge of PSN and N3. Particularly, I'm looking at longer ballgame work packages, looking at how we develop a mature classification strategy for social care and local government, and on that create some metadata standards for data within documents and forms, etc. At a more strategic national level, the NIB, the National Information Board framework, comes out in November, and what we hope to build upon, that was inferred in the slide that Andy presented, is to build a local perspective around what that means. And one of the initiatives that I'm promoting today, and perhaps asking for feedback for, is around the practicalities and desirability of developing some kind of digital maturity model to support local authorities around how you go about doing that, based on best practice, using standards, etc. So the maturity model framework we're looking to develop as best we can between now and March, and we're looking to set up a task group that is local authority led, starting this week. I just met with Dylan Roberts and Martin from Ferguson from Socitm yesterday, and we're trying to now get that project moving. The model itself will have multiple dimensions. In health, it looks principally at outcomes based on paper, moving from paper to electronic records, etc. But actually, I think we need to look at how a roadmap or a model for how services integrate and how we achieve that. And we also need to measure it on what impact and outcomes it has for citizens. So we're looking at developing a multi-branch kind of model that allows people to move at different paces depending on their local circumstances, and to focus on different dimensions of maturity.